If you have a bit of a head forward position with thoracic kyphosis, so that means a slouching position of your mid back, you tend to sit more like this or work a lot like this. You have chronic neck and shoulder issues and mid back issues, then this is the video for you. I'm going to show you a couple of different things in sequence as it's important to do this, and I'll tell you why as we go along. All right. So I'm going to show you the difference when I'm in this position. So a head forward and thoracic kyphosis. So that means a rounded mid back. My shoulder mobility is very limited. This is what I can do. Okay. But look at the differences when I bring my mid back straight. Okay. And I do a slight chin tuck. So what I'm doing is I'm elongating the back of my neck and I'm bringing it in, not aggressively, just slightly. And now look how far I can bring my shoulders back. You're like, well, why is that important? It's important because it's for the health of your joints in your shoulders and your neck and your mid back. And if you have chronic issues like that, it's not going to go away on its own unless you do a little bit of work for it and consistent. So this might be something that you want to try 2 to 3 times a week. It's going to be very quick, and I'm going to start with a slight chin tuck. You can do it seated or standing. If you are more advanced, you can do it when you're laying down on the ground, but you want to be careful because sometimes our neck doesn't like it. Okay, our neck is about controlling things. So if you are a bit of a controlling person, it's not going to like it. So you want to start nice and slow. So if I'm in this position, what I want to do is I want to just slightly tuck in my chin. Just like that. It's like bringing in a drawer, if you think about it. You hold it, 1, 2, relax. And then bring it in again. 1, 2, and relax. Okay? And you can do this, 4 or 5 times. But this head position is important, what we are going to do next. And next, what we are going to do is we're going to open up our shoulders in the front and activate these muscles in the back. So that is why I wanted to show you this in detail so that you understand. So we're going to start with our chin tuck. We've done that. Now we are going to hold this neck position as we open up our shoulder blades and work on this mid-back positioning. Okay, so the first thing you're going to do is you're going to grab a chair or your bed or something like that that you're going to be able to put your hands on, because we're gonna mobilize this part of our back, and we're going to have straight arms. Okay, so you see how my triceps are activated, and when that happens, this gets activated. Okay, which is important because we need that to be strong. Now, if your hamstrings are really tight, bend your knees a little bit. I know you can't see it, but bend your knees a little bit. That is perfectly fine. You're going to step back. Now, I'm going to show you how not to do it because this is probably what you're going to do at first. So we're going to not do this, okay? Our head is forward, our back is rounded. So let's correct it. Our knees are slightly bent, okay? We are going to bring our head in line with where it should be. Okay, I hope you noticed that. Then we are going to bring our mid back towards the floor. And what that does is you're going to have to open up your armpits. And this may be difficult. This may not be an easy thing. I need to step back a little bit, so I did. So I want it to look like this. My armpits are opening. My mid back it feels like I'm pushing it towards the ground. My head is in a good position. I'm looking towards the floor. Okay? And now you are going to step towards the chair. Breathe in, breathe out. We're going to do it again. All right? If that was really difficult for you, you need to do it more often. Okay, so hands on our chair, something that's stable, right? Activate your arms. Now we're going to step back. Now we're already going in a concave position, but it's not in our lower back. Do you see how I did that? We don't want that. We want our lower ribs going in and our upper back going out. like this. Not in the lower back. Do not go into lower back. You will get lower back issues and pain doing this. If you're feeling pain in your lower back, it's not like this, okay? Bring your pubic bone up this way, okay? Mid back in. You see how I did that? Okay, that's what I want you to do. It might take some practice, okay? It's just the way that it is. If you're not used to this, this just takes practice. Don't give up on it. So my pubic bone is towards my navel. My mid back is going in. My chin is slightly tucked. If you can straighten your knees, great. If you cannot, that is not what we are focusing on. I'm going to go a little bit further as it feels good for me. This should not be painful. It may feel stiff and achy. It should not be painful. Walk back towards your chair. Okay, so that we have done our chin tuck. We have worked our mid back. Now we are going to work on opening up our shoulders. Okay, as you can see, when I bring back my shoulders like this, the muscles in here are activated. That's what we want. We want those muscles activated. How do we do that? Well, we are going to bring our shoulder into a lateral rotation. So I am rotating it out. So I'm not rotating my forearm. That's not what I'm doing. That's easy. That's not what we're focusing on. We are focusing on the shoulder joint and rotating it out. Do you see how the muscles are activated in my shoulder blade? That's what we want. We're going to straighten our arm and then we are going to bring it back. But we're going to do this against the wall. But I'm just showing you in this position. And oh, you notice how my shoulder was starting to creep up? We want this shoulder down. We don't want it up. My body was trying to cheat. Okay, so we are going to do this motion against the wall. So our hip bar is against the wall. Our arm is against the wall. The shoulder, bicep, which means the front of the upper arm, and your forearm and your palm are against the wall. And this is intense, and I know. Okay, our rib cage and our mid back are not rounding. They are straight. Our head is in a chin tuck position, not too aggressive. Our neck doesn't like that. Okay? And so your arm might be way higher, which is fine. Now for the very flexible people, you need to activate your muscle tissue more, because otherwise all you're doing is just stretching out your joint. Okay? Some people, it's very easy to be very active, but for some of us, it's not. And if you are very hypermobile, you need to activate your muscle tissue even more, okay? So let's do it on the right side, because my right side is different than my left side. So I want you to see. So for me, this side is more difficult. I tend to go more forward with this shoulder. So I'm laterally rotating it, and then I'm bringing it into an extension. And this is as far as it wants to go. So this shoulder is just a little bit more limited. I have more issues with it. It's because my chest muscles are quite tight. And this is why I see a massage therapist regularly. I stretch regularly. It's just something that I do with work, as I am a massage therapist, and I tend to favor this side. I'm trying to work on it, but it's easier said than done. All right, so if you can hold these stretches for 30 seconds, that is great. If it is just too intense, lower your arm. You might start in this position. That's perfectly fine. Activate the triceps, push that arm into the wall, your hips against the wall. If you can put your foot against the wall. Unless you have balance issues, have a chair in front of you. It takes some time to just figure this stuff out sometimes. If you need to go higher, you can. This is my limit for my right arm. This is just where I'm at with it. It's just what it is. So I'm accepting it. I work on these every second day. I stretch this out, and it always feels better after. Okay, so that was a lot. You might feel some blood flowing down the arms. Let it kind of relax for a second. Then what I would like to do is work on the back of our arms, because it helps to open up our armpits. And our armpits need to be able to be open so that we can do this motion in life. and so that we can do this motion in life. And so this is important for us to do. And especially as we get older, we tend to do it less. And that's why we should really be doing it, because it keeps everything nice and relaxed, especially into our neck. If our shoulder joints are extremely limited in our motion and the ability that it has to do, our neck becomes even tighter, because we just get more and more into this position, and there will be more and more problems that we get. So it is possible to fix this. We just have to be diligent with it. So a tricep stretch, we can do the good old stretch like this, but be careful of our neck, right? So we want to keep our chin tucked in so that, one second. So we can do the tricep stretch like this, right? But we want to make sure that we're not throwing our chin back out. We want that chin to be tucked in. So if that's really difficult for you, what you can do is, again, you can use the wall. The wall is your friend. The wall is amazing to do stretches with. So what I'm going to do is I don't know if you can see this nicely, but I'm going to put my elbow against the wall, and then I'm going to slide it up the wall and bring my hand towards my shoulder blade. And then I can push my body into the wall and stretch this whole side. Like when I do that, I can feel it all the way down here. Even my rib cage, I can feel it. And what I'm doing is, if this were to be the wall, I am literally pushing into it so that this whole side gets stretched. And it feels amazing. Okay, and then you want to slowly come out of it, because these are intense. So take your time coming in and out of these kind of stretches, okay? The last thing that we're going to do, I'm just going to grab my chair, is we are going to do a really nice neck stretch. And this is something that you can, again, be gentle with and take your time. And so we know our chin has to be in a good position in order for our neck to stretch appropriately. Now, what we're going to do is we are going to make sure we are not sitting like this. We're not also sitting like this, okay? It's a nice, long spine, like a giraffe. Although they lean a little bit forward, don't they? Yeah. Okay, scratch that idea. Okay, what we're going to do is we are going to slightly turn our chin towards the left shoulder and look down towards our armpit. This right hand is going to be underneath your butt cheek, because it's going to stabilize the shoulder. This left hand is going to grab the back of your head. Now I want you very gently bring in your chin towards your armpit. You should feel no pain. Now what I'd like you to do is I'd like you to just try to bring your head back up, but your hand's not going to let you. 1, 2, 3, 4, 5, 6, 7, 8, 9. Keep breathing and relax. Come out of it. Now let's see if you can go a little bit further. Okay, great. We're going to do it again. Holding your head and then pushing into your hand. 1, 2, keep breathing. 6, 7, 8, 9, 10. Good. Breathe in, breathe out, and now stretch it out. It should always feel good. It should never hurt. Stretching is not about hurting. If it's hurting, you've gone too far. If it's hurting, your nervous system is not going to relax and let you move your head any further. We're going to do the exact same thing on this side. Sit on your left hand. You're going to look towards the right. Look towards the right armpit. Take your right hand. Slightly bring it a little bit further and then push into your hand. 1, 2, 3, 4, 5, 6, 7, 8, take yourself out of it. Do a breath. Okay. And do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax and stretch it. See, now I'm starting to feel a little bit of pain, so that tells me, okay, you've gone a little bit too far, so I'm going to back out of it a tiny little bit. That feels better. There, that's a good spot for me. And just remember to breathe when you're doing this, and you want to just go nice and slow with your stretches. There's no need to rush through this. And once you start to do this sequence a couple of times, because I'm obviously chatting through it, it really should only take you about 10 minutes. That's it. 10 minutes, you know, every second day, every day, if it feels good. And, you know, if you need to make some adjustments, you absolutely can. You can work within your limit, but these are an excellent little sequence to help with mid-back, shoulder, and neck chronic kind of issues that you're dealing with. Enjoy your day. Bye-bye.